So, through the COVID pandemic, government response has, of course, been one of the largest factors influencing whether a country was successful in dealing with the pandemic or failed. Every single country at this point has been infected, from Tuvalu to Tanzania, and their different responses have been crucial to how the world has responded. Some countries, of course, have fared much better, and I'm looking at Brazil and New Zealand, two countries somewhat on opposite ends of the spectrum in terms of their COVID response. Now, I used 5 sources to analyze this, Brazil and New Zealand, and the first source, the most helpful, was a NIH report by 3 scientists analyzing New Zealand's COVID response in terms of all aspects, governmental, on the healthcare side, everything. It was written in August of 2020, so it's a bit old, but the things it's covering are there. It is written by Michael G. Baker, Amanda Kvalsvig, and Aisha J. Varel. It was published in the Medical Journal of Australia too, and it covers a few main things. It covers primarily the 5 types of dealing with a pandemic. There's the exclusion strategy, which like Small Island did, elimination strategy, which New Zealand did, suppression, which the U.S. did, mitigation, which Sweden did, kind of herd immunity, and then just no strategy, which Brazil did. So that is sort of what it covered, and it also covered the how New Zealand responded in general, their quarantines and everything. They shut down the borders entirely. You can sort of see that here. And then the second source was a press release from the Médecins Sans Frontières international organization. This was a press release released just this month, April 15th, and it analyzed the failures in Brazil and sort of how it was a mainly governmental problem. The federal government took no action, and it's pointing out the problems caused there. So it's trying to bring attention to that and ask that the government of Brazil take more action. Brazil is now the 3rd highest country in terms of death count, and it's really problematic. Now, this source is actually really strong because it's a press release for public safety health from a very respectable source. The Médecins Sans Frontières dealt with Ebola in 2012, so it's likely this is a pretty strong source. Now, the third source was a Time magazine article by Ian Bremmer. It talks about just some of the better COVID responses in general, like Taiwan, South Korea, and New Zealand. It analyzes more what New Zealand did on the the PR front. It talks about how New Zealand cut salaries to its leaders, and how now they've got, this is a photo from just recently, it's 50,000 people in a concert, because New Zealand, surprisingly, has not had a single case for months. They had in total 26 deaths ever. So that's incredibly hard to understand for me. But yeah, it talks about New Zealand's response, and that's compared to what we mentioned. Brazil just passed 330,000. So 2 different responses. And then the fourth source was a sort of a blog, but not really, from Marcia Castro, who was actually the chair of the Harvard University Department of Health, is actually the chair of the Harvard University Department of Health. This is from June of last year, and it talks about how Brazil really should have been able to handle this, but didn't. This is a graph of Brazil's response to H1N1, and surprisingly, it was one of the better responses globally. Brazil had a very well equipped healthcare team and healthcare system, but due to some federal, like the president was, it talks about how the president was denying the existence of COVID and how they cycled through two health ministers at once. It analyzes really how COVID should have been dealt with better in Brazil, but couldn't have been. And finally, the last source is a direct website from the New Zealand government, covid.nz. covid.gov.nz. And it's a very helpful page. It talks about the government response. It's a daily newsletter from New Zealand directly, and it's perhaps one of the strongest sources possible. It's literally a primary source from the government. It's meant for public service entirely, no entertainment at all. And then as for some of the other sources viabilities, the blog from Marcia Castro, it's sort of a weaker source because it's one person and they could have personal opinions, but in reality, they are very well knowledged about the subject. They're a Brazilian and they work at Harvard, so it should be a pretty strong source. And then the Time article, that one, it's sort of a bit more iffy there too, because it's almost sort of meant to entertain, mainly to inform, but there's some sort of clickbaitiness in there, and you can see that there, but it should still be a pretty strong source. And then that's all, my 5 sources, but from it together, we can sort of build a picture of why Brazil and New Zealand's government response were so different. New Zealand chose to take the response of suppression and mitigation, just eliminate the virus entirely within a specific area, not eradicate, eliminate. So no cases in an area. New Zealand went early, hard, and immediately. They shut down their borders very quickly, and they managed to stop basically any cases spreading. They took a early hardline response, and it paid off in the long run. Then Brazil just didn't have a federal response. New Zealand's government came straight from the top, action spread outward. Brazil, people had to work on the local level because there was no support from the federal government and just the government in general. It led to there being no cohesive plan, and Brazil couldn't deal with COVID. There's currently only have about 11% of their population vaccinated, and overall Brazil's response has just been very lackluster. And so the sources really talk about the differences there, the 2 strategies, no strategy versus mitigation, and it really paints a good picture how Brazil had no government response and it led to a failure of the healthcare system, whereas New Zealand had a strong government response immediately and it worked out well. Now, as for some more ways to research this, there are actually quite a few. Of course, there are a few resources you should keep an eye on. The Médecins Sans Frontières, if there's any more developments, they'll release more press releases. And then also the World Health Organization, of course, if Brazil's situation becomes worse and worse, they'll release some statements too. However, the CDC is US-based, so they wouldn't be the best. But it's also a good idea to keep an eye on the news sources of the country themselves. This is a Brazilian news source, so watch the news from each country, and it'll paint a relatively good picture of each country too. And that's the government response to COVID in New Zealand and Brazil, and how it affected their overall COVID response.